If you're getting close to 65, here's something nobody warns you about: the mailbox onslaught. Postcards, brochures, phone calls. Seemingly overnight, you go from getting normal mail to getting 40 pieces of Medicare advertising a week. And most of it is designed to get you to make a fast decision, not a good one. Here's the truth: choosing a Medicare plan at 65 is one of the most important healthcare decisions you'll ever make, and is not as complicated as it feels once someone actually explains it to you. That's what we're doing today. I'm going to walk you through exactly how Medicare works, what your real options are, and how to think through this decision so you can choose with confidence, not confusion. Let's get into it. First, let's talk about why this decision deserves your full attention. When you turn 65, you get what's called your initial enrollment period. It's a 7-month window centered around your birthday month. It's the best time to make your Medicare decisions because during this window, you generally have full access to every option available to you. Miss that window or make the wrong choice without understanding the trade-offs, and you could face permanent late enrollment penalties, gaps in your coverage, or find yourself locked out of certain options down the road. This isn't about scaring you. It's about making sure you understand that this decision has staying power. So let's make sure you get it right the first time. Let's start with the foundation: Original Medicare. Original Medicare has two parts. Part A covers hospital care, things like inpatient stays, skilled nursing facility care, and hospice. Part B covers medical care, doctor visits, outpatient services, preventive care, and durable medical equipment. Together, Part A and Part B are the base layer of your Medicare coverage. Most people don't pay a premium for Part A if they've worked and paid into Medicare for at least 10 years. Part B does have a monthly premium, but here's the critical piece almost nobody explains clearly. Original Medicare by itself has no cap on your out-of-pocket costs. There's no ceiling. If you have a serious health event, your 20% share of the bill under Part B could add up to a significant amount, with no maximum limit protecting you. That gap is exactly why you need to choose a path to fill it in. And that brings us to your two main options. Your first path is what's called Medigap, or Medicare Supplement Insurance, paired with a separate Part D prescription drug plan. Here's how it works. Medigap plans are sold by private insurance companies, but they're standardized, meaning a Plan G from one company covers the same basic benefits as a Plan G from another company. The main differences between companies come down to premium and customer service, not the coverage itself. Medigap policies help pay for the gaps left by Original Medicare, things like coinsurance, copays, and deductibles. Two of the most commonly compared plans are Plan G and Plan N. Generally speaking, Plan G covers more of the gap and tends to have a higher premium, where Plan N shifts a little more cost sharing to you, like small copays for doctor visits, in exchange for a somewhat lower premium. Because Medigap doesn't include prescription drug coverage, you'll also need to enroll separately in a standalone Part D drug plan. Now, why do people choose this path? The biggest advantage is freedom. With Medigap, you can see any doctor or specialist in the country who accepts Medicare. No networks, no referrals needed. Your costs also tend to be highly predictable from month to month, which many retirees find gives them real peace of mind. The trade-off is cost. Medigap premiums are generally higher than Medicare Advantage premiums, and you're paying for two separate policies: your Medigap plan and your Part D drug plan. This path tends to appeal to people who travel frequently, have a specialist or doctor they're not willing to give up, or who simply place a high value on predictability over saving money each month. Your second path is Medicare Advantage, also known as Part C. Medicare Advantage plans are offered by private insurance companies that contract with Medicare to provide your Part A and Part B benefits, and often your Part D drug coverage, all bundled into a single plan. Many Medicare Advantage plans also include extra benefits that original Medicare doesn't cover at all, like dental, vision, hearing aids, and sometimes even gym memberships. The appeal here is clear. Many Medicare Advantage plans come with a very low monthly premium, sometimes even $0 a month, beyond what you're already paying for Part B. You get those added benefits bundled in, and unlike original Medicare alone, Medicare Advantage plans do include an annual out-of-pocket maximum, which gives you a ceiling on your potential costs in a given year. But there are trade-offs to understand. Medicare Advantage plans typically operate within a network, meaning you may be limited to certain doctors, hospitals, and specialists, depending on whether it's an HMO or a PPO structure. Some services may require a referral or prior authorization, and plan details, pays, covered drugs, provider networks can change from year to year. So it's important to review your plan annually. This path tends to appeal to people who are comfortable working within a network, want those extra built-in benefits, and are prioritizing a lower monthly premium. Let's put these two paths side by side because seeing them together often makes the decision click. Medigap plus Part D, higher monthly premium but nationwide freedom to see any provider who accepts Medicare, and highly predictable costs. Medicare Advantage, lower, often much lower, monthly premium, extra benefits like dental and vision, and a built-in out-of-pocket maximum, but with network restrictions and potential plan changes year to year. I want to be really clear about something. Neither of these paths is objectively better. I say this in every video, but it matters most right here. The right choice depends entirely on your personal health needs, your travel habits, your relationship with your current doctors, and your comfort level with trading flexibility for savings or savings for flexibility. Now let's talk about where people commonly go wrong. The most common mistake is what I call the set it and forget it trap. Someone picks a plan at 65 and then never looks at it again. Not the next year, not 5 years later, not ever. But your health needs change. Plan benefits change. What made sense at 65 may not make sense at 72. Second, timing matters more than most people realize. If you delay enrolling in Part B or Part D without other credible coverage, like an employer plan, you could face late enrollment penalties that follow you for the rest of your life. And third, this one catches people off guard. If you choose Medicare Advantage first and later decide you want to switch to a Medigap policy, you may have to answer health questions and go through medical underwriting. That means a health condition that develops after 65 could limit your ability to switch to Medigap down the road. This is exactly why your choice during that initial enrollment period deserves real thought up front. So, how do you actually make this decision? I want to leave you with 3 simple questions to ask yourself. Question 1. Do I want to keep seeing my current doctors and specialists, no matter where I am in the country? Question 2. Am I comfortable working within a planned network in exchange for a lower monthly premium and extra benefits? Question 3. What can I comfortably afford as a predictable monthly cost versus how much protection do I want against a large unexpected medical bill? Your honest answers to these 3 questions will point you toward the path that fits your life, not just your budget, but your peace of mind. This is exactly the kind of decision I help people work through every day. not as a sales pitch, but as part of looking at your full retirement picture. Here's what I want you to remember. Medicare is not one size fits all, and the choice you make at 65 can shape your health care coverage for years to come. Understanding your options now, Original Medicare, Medigap, and Medicare Advantage, puts you in the driver's seat instead of leaving you to react to whatever piece of mail shows up. If you want to learn more, check out the free booklet called Retire Smart. It's linked in the page in the description box. If this video helped bring some clarity, hit subscribe so you don't miss the next one. I'm Shonda Prescott, and this is Retirement Security Simplified, where we specialize in turning confusion into confidence, one conversation at a time.